As orthopedic surgeons, we've always been going after accuracy in our surgeries, whether it be fracture fixation or joint replacements. We are always looking for how accurately we have done the surgery, whether we have put the plate in the correct angle or positioned the joint in the correct angle. So angles and measurements are of foremost importance in orthopedics. So we've been doing traditionally with instruments called jigs, where we use a little bit of eyeballing, we use our judgment, and surgeons were getting better and better at it over time. But as you know, nobody can be 100% perfect, and very good surgeons have published their results, and what it showed was surgeons were accurate about 85% to 90% of the time, not more than that. What angle we exactly wanted, we were able to hit it about 85% to 90% of the time. Rest 10 to 15% of the time, it varied by more than a few angles from what we intended for. So here is how, or here is where the robot exactly fit into the orthopedic armamentarium. So robot has a navigation technology plus a lot of decision making tools, where surgeon makes the decision which angle we can place the implant in, and robot helps us accurately position the implant in that angle. And there have been a lot of studies done with the robot, and good robots are about 99% accurate. So if you do it 100 times, you are likely to get it perfectly right 99% of the time. That is how robots have advanced orthopedic surgery, and particularly hip and knee replacements in particular. But have they solved all problems of hip and knee replacement? No, there are still issues remaining that we need to solve or make better in terms of functioning of a hip or a knee replacement. Things like infection, things like dealing with very weak bones, dealing with ligament balancing. All this still requires a fair amount of effort to make it perfect, and a lot of research and activities are going on to make these aspects as perfect as possible. Robotics has solved one part of the problem for us.